Good morning, everybody, and welcome to another podcast. And morning, Theo, you good?
Good morning, Andy. Very good indeed. It's an incredibly hot day. Perhaps British summertime has finally arrived.
Oh, I think, yeah, it's supposed to be 34 degrees today. But anyway, what we're actually going to talk about today, guys, is we're going to talk about ADHD. And how do you... In fact, actually, I'm going to throw this back at you. How do people manage with ADHD? Because there's so many questions arising in terms of how do you know what the signs are? How late do people discover them in life? And would their lives have actually been any different had they discovered it earlier? Sort of things. And I'll give you an example because I've got ADHD. And I wasn't particularly great at school because I really struggled to focus. And the thing is also, people with ADHD don't tend to be auditory learners, so they can't sit there for best part of 45 minutes and actually pay attention and digest all the information. There's got to be a very different learning style. Now we've actually got that. We're actually discovering things like that in the later years as we've progressed. But the thing is, had they known about it in such an early stage, how would it have impacted their lives further on? And actually, how do they cope with it now? So, and there's a lot of things to actually answer on people with ADHD. So let's start off with, really, what are the signs of ADHD?
Okay. I mean, that you opened an enormous topic. And
it is an enormous topic. But,
and let me tell you, the effects of ADHD that is untreated and not dealt with properly are so profound that I think it's officially, in terms of the American Psychiatric Association, one of the causes of personality disorder. In this case, damage to your personality at a young age that you carry through life. The reason is that ADHD itself, chemically, is due to a lack of dopamine. You don't have enough dopamine, so you can't concentrate, you're not patient, you're impulsive, you're distractible, you can't wait for things, you're fidgety, you're a good starter, poor finisher, disorganized, forgetful, appearing not to listen to and spoken to directly, butts into people's conversations and or games. These are all part of the official diagnostic criteria.
Okay. So I already know the answer to this, but I'd like you to sort of explain it, because when you say to people they don't produce enough dopamine, which in effect is a happy hormone, yeah, it's a good feeling hormone. Would that indicate that people with ADHD are actually on the negative side of the spectrum?
Negative side of what spectrum?
Are just negative people in general, so they see the glass as half empty rather than...
No, not at all.
Because if you're not producing that dopamine, I'm saying, and it's the happy hormone, and someone actually, let's say, has normal levels, or even a more abundant level of dopamine running through their system, the reason I'm saying is, it may appear that they would be more negative, in theory, if you're not producing enough dopamine.
Good point, but not quite, because what I call a peace of mind neurotransmitter is actually serotonin. Dopamine is the pleasure neurotransmitter. It is the instant gratification. It's what Facebook and Instagram have hooked people with. The little dopamine hits.
Okay, so would you say people with ADHD are therefore more susceptible to becoming easily addicted to things because of the pleasure, the instant gratification that they seek?
Okay, again, not quite, but there is a risk. So if we just go through the symptoms first of all.
Okay.
What I went through was exactly what you'll see in the WHO and the American Psychiatric Association DSM guidelines, and they must be present since childhood. Very, very rarely can one countenance something in adulthood developing de novo. But generally it's supposed to be a neurodevelopmental disorder, and exactly for that reason, ADHD tends to occur more often than you'd expect with things like dyslexia, dyscalculia, even autistic shift. And also, very importantly, because it's this massive effect, meaning for treatment, is you do get a raised probability of rapid cycling mood disorder. Rapid cycling mood disorder.
Okay, layman's terms?
Bipolar.
Okay. So you're more susceptible to bipolar?
If you've got ADHD, correct. Now, it's also happens more when you're more likely to get clinically depressed, so that about 25% of cases of clinical depression have undiagnosed ADHD, and the depression will not recover until you treat the ADHD. If you think about the sheer number of people who are going untreated, because how many people with clinical depression do you know are suddenly diagnosed with ADHD and treated? Right? So one of the first things that I tell people, one of my, one symptom I've spotted, and it's both a symptom and a sign. So a symptom is something you complain about. A sign is something that the doctor sees. Is tricky sleeping. A lot of people...
Sorry, tricky sleepy, I mean...
Tricky, well, I call them a tricky sleeper. Yeah, it is a medical term.
Sleeping.
It should be. And it's not in the diagnostic manuals. But if you talk to everyone with ADHD, almost everyone say their mind is too active for them to get to sleep at night. And they tend to fall asleep when they're physically exhausted. And the quality of their sleep is not that great. And a lot of them will self-medicate with things like cannabis. Okay? So the thing with ADHD, there's a bigger chance that you're going to be a drug abuser, especially cannabis or the opiates. Because what that does is it tends to damp down your mind. It doesn't focus you, it damps it down, so you do get some sense of relief. Okay? And one of my Dr. Theo signs for ADHD is an inexplicable failure to succeed in life in someone who is otherwise a intact personality and a hard worker and intelligent. Motivated, intelligent, intact personality, inexplicably failing to succeed in life. Reason being, they're good starter, poor finisher, disorganized, can't keep at things.
Poor finishers, yeah.
Exactly.
It's interesting because, I mean, as I said, I've had, I think I only really found out I had the ADHD probably about 5 years ago, not long ago, and because my daughter has it, so it was easily identifiable in that respect.
It took me some time, didn't it, until I said go to your GP.
That's right, and it took me, and having been an insomniac for the best part of 30, 40 years, I always used to have to keep a notebook at the side of my bed because the thing is we talked about all the negative effects of ADHD, but there are positive effects as well. So it's like the woman who diagnosed my daughter with dyslexia basically said not all geniuses are dyslexic, but not all dyslexics are geniuses, but all geniuses are dyslexic. All right, and in some ways, there's if you actually learn to ride or understand your talents, or the talents that come with ADHD, you could probably adapt and actually and work with that. And because the thing is, you'll have so many people with ADHD who are big dreamers, great thoughts. And as I said, I have to keep a notebook by the side of my bed at night because if I don't write it down in the morning, that thought will have gone. Now, I'm not saying it's going to be any multi-million-pound thing because a lot of the ideas are crap, but you get some very good ideas that if they were properly applied can actually make significant differences in this world, I suppose. But so the thing is, so even though there is a negative side to ADHD, if you actually sort of run with that wave of knowing actually this is my talent and knowing, and it's about self-awareness, knowing what you're really good at because of ADHD, but also knowing what you're limited by with your ADHD and how to actually overcome that. So, someone who wants to start a company with ADHD, great, because they're very motivated to start. I think ADHD people are probably easily motivated at the beginning, but if they're not getting the reward very quickly, they tend to fizzle out. And so a lot of these people who will start businesses like entrepreneurs and things like that will have the entrepreneurial behaviour or characteristics. You'll probably see a scale of where there's an element of ADHD involved, because it's also a sliding scale on how much dopamine you produce or not.
Well, that's right. It is a sliding scale. So you can have mild, moderate, severe, and just to put it in perspective, 1 in 10 children have ADHD, and there's a strong genetic link. You can almost guarantee someone else in the family will have it. Almost guaranteed. And about half the kids will grow out of it. So that means 1 in 20 adults have. Just imagine that. Everywhere you go, 1 in 20 adults have ADHD. The oldest person I diagnosed and treated successfully was 68. So no studies have been done in adults to see how many of those grow out of it. But what I have noticed is that some people I treat with medication, after a few years, are able to come off it. And the reason, I think, it could be because they've grown out of it, I'm not sure, but I also think it could also be because concentration is a habit, it's a discipline. And if you are able to develop the discipline of concentration, then maybe you've got a fighting chance of continuing it off the Ritalin.
I think you're right. I think it is a habit. But it's not just so much about your concentration. It's just about how the way you go things. So you do probably become more organised, or you attempt to become more organised. There's always going to be things that your natural traits will actually come out in that respect. But you can become more organised, and the thing is, once it starts creating a habit, then you probably don't need it. But it can also come up in the most unopportune moments as well, when you least expect it, because that behaviour doesn't go away.
Doctors are not trained properly in ADHD. Neither are psychiatrists. The first time I came across it was when I was a consultant working privately, and the GP said, "Do you see children with ADHD?" And I said, "Of course I do." Then I went straight to the textbooks, looked it all up, treated the child, and then the mother rang me up and said, "He's doing amazingly, but my husband thinks he might have something similar. He's taken some of the tablets and he's doing really well." So I said, "Oh, now that's a Class B drug. Your husband has done something illegal, so tell him to come and see me." And he did, and I treated him too.
But here's the question. Because the thing is, let's say parents are listening to this and they've got kids, and they're probably wondering, one, do I put them on an amphetamine, which is what Ritalin and things like that are, and two, in some ways it almost doesn't make logical sense. You're giving someone, in effect, what is speed to actually calm them down. It almost sounds like a bit like an oxymoron, doesn't it?
Well, thank you for that. So two things then. Because it's not properly explained in the textbooks and we're not taught it properly, I had to work it out. So once you understand the deficiency is dopamine and the medication raises dopamine, I then would prescribe people the Ritalin, and they would come back to me and I'd say, "Come back in a week, see how we're getting on." And some of them, bless them, because they're human, okay? So you take a tablet, it doesn't affect you. You think, I'll take 2. Ooh, look, I'm feeling calm and focused. I better take 3. Let's see if the effect is additive. Ooh, I'm feeling even more calm and focused. I'll take 4. And what happened at that point is they get agitated, and then they panic and think, "My God, it's wearing off. I'll take 5." And they would get more agitated, and then they'd ring me up or come and see me in a panic. So I said, "Well, did you stick to the dose we talked about?" "No, I didn't, sir." But what I worked out was that if you have a low dopamine level, that the medication raises your dopamine, and it only gives you the benefit if you hit the normal range. In other words, what is the normal range for you? If you take too much, it goes through the top of the normal range and therefore hyperactivates you, just as it's a drug of abuse.
So let me ask you a question, because and I've experienced it a couple of times myself, having taken Ritalin. The thing is, you're talking about Ritalin on its own.
But by the way, none of us are licensed medical practitioners, so just bear that in mind, gents
I'm talking about from my experience.
and ladies.
My credibility in some ways is hopefully coming from my experience. looking to ask is, if you just take Ritalin on its own, that sort of thing you're measuring it against. You're not measuring against the other things you take in your diet, like coffee, for example. If you have too much coffee while you're on Ritalin, that can also in some ways make you overdose in some ways.
Yes.
That be right?
So
same with taking cigarettes.
So that's the beauty. Once, and I am probably the only doctor I know who explains it in so much detail, to the extent that people will come and see me now without a license to understand it, in preference to other psychiatrists. What you just said is absolutely correct, that a stimulant will raise your dopamine. So if you're taking your Ritalin, you cannot involve any other stimulants. So anything with caffeine, tea, coffee, Coca-Cola, Red Bull, chocolate drinks, tea, coffee, Coca-Cola, Red Bull, chocolate drinks.
Caffeine, in effect.
With caffeine, nicotine, okay? Also, in cold remedies, there's a drug called pseudoephedrine that vasoconstricts the vessels so to stop your nose running. That's also a stimulant. All those need to be cut out. And interestingly, anything else raising your dopamine. So, for instance, if you do a heavy exercise session, it's going to raise your dopamine. Interestingly, one patient came and said to me it stopped working. I said, what happened in your history? She said, I'm in a new relationship. I'm in love. Guess what? Being in love is a hyper-dopaminergic state. So she didn't need her medication while she was in love.
In the fluffy stage.
In the fluffy stage, as you say. That special feeling, as Alain Le Breton puts it. So it's so sensitive that one of my patients changed jobs. She would always go to the same tube station, get her Starbucks. Her new job was further away. And it allowed her to finish her entire cup of coffee, whereas the first job, she'd only finish about a third of it by the time she got to work. When she changed jobs, she came and said to me, it stopped working, this tablet. Reason being, the entire cup of coffee with all the caffeine pushed her above the normal range of dopamine, so she got agitated.
So I just want to further add to that, because we're talking about stimulants in terms of coffee and things like this. Particularly if you're older, you could potentially be on other medication. I mean, how does, when you start mixing two pharmaceuticals together, can probably potentially have an adverse effect.
It depends what you're on.
Well, let's say blood pressure, for example.
Shouldn't affect it at all.
Okay.
If you're taking it correctly at the right dose.
But that's the problem, because people don't always do that. I mean, there'll be times when I thought, did I take my Ritalin this morning years ago? And all of a sudden, I can't remember, and you probably end up having double the dosage, which will have an impact. But I just want to go back to the question you talked about poor sleeping habits, for example, and you talked about people use, for example, cannabis to calm down. And the thing is, I don't know whether we've been sold this story on cannabis because there's a lot of medicinal purposes, and you hear how the pharmaceutical industry pushed to actually have cannabis banned as a drug and things like that. We're taking cannabis to settle down at night and actually get to sleep. Not that it's everyone's choice of medication, or is it better to take a sleeping pill? Because if you're not sleeping, I mean, the thing is that cannabis, because cannabis in some ways is a more natural thing.
That's a very hard question, because one is illegal and the other one isn't. Yes, one is illegal, one isn't. Assuming in a parallel universe that cannabis was not illegal, okay, in a parallel universe, because we know it's illegal, although they are talking about legalizing, aren't they? But nevertheless.
Well, the thing is, the police aren't really, it's not legal. The police aren't arresting people for it anymore, pretty much, because they just haven't got the manpower.
Were you a policeman? Were you interested in it?
Not really. The paperwork was far too much, and
disproportionate.
And then you've got to send it to the lab. It comes back, it's probably safe.
So, but the trouble is that a lot of cannabis use from an early age does cause a motivational syndrome. It dumbs you down, and you don't want to do anything. There is a risk of cardiovascular disease with lots of cannabis. And
cardiovascular as well.
Cardiovascular disease. Have no idea, but it's there in the research. And if you start it early on in your teenage, it does raise the risk of psychotic illness.
Which is what makes people start when they start taking cannabis, I suppose, because your brain's not fully developed. I mean, they say it's not
Exactly.
fully developed until you're 25 or 24, so at that age. And the thing is, people are always worried about being a gateway drug, and I think it probably is a gateway drug.
And yet I'm sure there's some people who use it effectively and helpfully, and it is therefore superior to sleeping tablets, but it's just a very difficult area and very specific to the individual.
Because it's deemed illegal.
However, you have raised this issue, and what I worked out, looking at the research papers as well, is that a dose of Ritalin an hour before bedtime in many people with ADHD gets them off to sleep nicely and improves the quality of their sleep, even in children. In fact, the first time I did it was with a 6-year-old, and his mother came. The first time I picked him up from the consultation room, we had to pull him from underneath a chair. The second time, after I put him on medication, he'd had his trial of treatment. He was sitting reading a book, got up, came to me, and the mother said, "I can't thank you enough. It's the first time since his birth that we're both sleeping through the night."
We're talking a lot about the medication for ADHD, and it's an important topic because you'll have parents who are wary about giving their children amphetamine, and then you'll also have parents, and it's probably more like this case 30 years ago, that you never admit that because you will want the perfect children. You never want to admit that there's anything wrong with them, so you dismiss it.
Can I talk about, therefore, just finish off the tablet treatment,
okay,
and then talk about the consequences of not treating it.
Okay, that's probably a good idea.
So the as we said, methylphenidate is the main stimulant used in the UK. There are other things that raise dopamine, such as atomoxetine, which works a bit like an antidepressant but doesn't raise your mood. What I mean is it has an additive effect and you have to continue taking it. Then there's guanfacine, which is a central alpha-2 receptor agonist, which also raises dopamine in the, I think it's the prefrontal cortex. And then in America, they've got dexedrine, which is also known as Adderall being a mix of salts. With Ritalin, of course, with methylphenidate, you get also the standard release and slow release, Concerta, methylphenidate modified release, etc. Then there's unlicensed ones like modafinil or Provigil, which people don't really talk about. But actually, if you do not want to take a Class B drug, it can work, but you do need a high dose of about 400 milligrams a day. And what that is, it's a histaminergic agent. So you know antihistamines sedate? Well, this is a histaminergic. It's an agonist, so therefore instead of sedating, it has the opposite effect. So those are the medications. Now the consequences.
Okay, no. Before you do that, because let's stick to the medication for a second, because you've discussed the positive effects, and I think we need to be quite objective about it. What are the side effects?
Okay, great.
Because, and I'll say it because the thing is, when I was taking it earlier on, I found that I wasn't as creative. Because the thing is, obviously, look, we only use 10% of our brain at any one time. So the thing is, ADHD people will generally tend to be more creative. You give them Ritalin to calm them down so they focus, but they lose their creativity.
Okay, now you call that side effect, okay? Now, when I'm helping parents manage their children, because I'll tell you right now, if you have a severely ADHD child, parents get to dislike their children, okay? Because they're impossible. They are relentlessly hyperactive. They are impulsive. They are difficult. They do not listen. They are impossible. And they get in trouble at school a lot. Now, the one of the things I tell them is imagine the film The Mask with Jim Carrey. And what did the mask do? This mask magnified your personality. And because Jim Carrey was a gentle, loving, shy romantic, then what the mask did is it removed the shyness and made him into an incorrigible, impulsive, witty.
Some people will call that alter ego.
Alter ego, indeed. But yet, when the bad guy took it, it turned him up into a venomous monster. Okay.
So it just enhances who you really are.
So I say to parents, imagine that what you're seeing is not your normal child. It's your child with a mask of ADHD. And what that means is that when you're getting angry and scolding and even physically chastising your child, including physical restraint, which many have to do, you're doing that to his ADHD or her ADHD. But the child is taking it and absorbing them into their soul and personality. Okay?
Mm-hmm.
And you are damaging your child, sometimes irreparably. And not a single parent has declined a trial of treatment once I put it in those terms. If I need to pad it out even further, I tell them, okay, I say, what's important in life? You need a positive self-esteem, and you need to be socialized. And what ADHD does, it massively reduces your socialization, and it destroys your self-esteem through your chastisement, scolding, and
From a young age.
And failure at tasks and academically.
Would that be one of the reasons? Because people procrastinate. Is because if a task is almost too difficult, because the thing is, procrastination isn't about lack of motivation or laziness. It's more to do with fear of actually getting something wrong and things like that. Or that's one of the studies that have said what procrastination is. So the thing is, because you're getting a particularly difficult task, and you've got ADHD, and you're losing focus because it's not exciting for you, or it's boring for you, you are not stimulated enough to actually want to finish it. Whereas someone who's probably on the other side of the spectrum is more likely to... and actually, let me go back a second. I actually wonder whether people with ADHD are actually early risers, whereas people on the other side of the spectrum can actually work until 2 o'clock in the morning. Whereas when I was actually doing my postgraduate, I actually had to get up at 3, 4 in the morning to do it because my brain was more active. But that's just wondering, just to throw that in there. Would that be sort of behaviours that
that's a hard one.
Persistent.
It's a hard one because, of course, people can't get to sleep, so then they wake up exhausted. So that's a tricky one. But one thing that I need to carefully educate parents on is if they physically restrain or slap or use some kind of physical measure. For instance, one of my patients as a teenager, the only way his father get him calmed down was to turn on the high pressure hose on him in the garden. Now, what physical means do, and also sudden shouting, by the way, sudden scolding, sudden emotional stimulation, is it raises the dopamine. And therefore, what the parent sees is a perfectly compliant, calm, focused child for about 15 minutes. And they think, oh, they're just being naughty. A good shout, a bit of a slap, and they behave. Okay? Wrong. You've just raised their dopamine. In fact, one of my patients told me yesterday, as a 15, 16-year-old, he used to beat himself with a belt because that would give him calmness, because it raised his dopamine. Okay? You must know this as a parent, okay, to help your precious child. Okay? And in fact, once someone told me, well, they skip and they look so happy, and the medication takes us away from my child. I said, no. If you watch it, the skipping is the ADHD. When they're on and they're calm and focused, they're just walking like a normal human being. You see the tablet wear off, they start skipping. That's the mask coming back on. Okay? And what's super important is that schools are very, very bad at this. And because parents are not
identifying it, or
at both, they're bad at identifying it, bad at treating it and managing it once it's identified. Why? Because they're lazy.
Actually, I'll probably have to disagree with you then. It's not so much laziness. I think teachers don't actually have the experience to deal with that. They're teachers at the end of the day. They're not.
Well, no. You think
they're not.
You're being very nice, Andy. But the fact is that if 1 in 10 kids have it, teachers better know how to spot it and help manage it. And the fact is that when I say lazy, they are. Everyone wants an easy life, including teachers. And I've been to see headmasters, and the only way a school will behave is if you make them.
You've also got to consider with a lot of these schools, it's all political. And I say it's political because particularly like private schools, they're exam passing factories. Nothing wrong with that. They're an exam passing factory. And the thing is, if you suspect a child's got dyslexia, they'll get an extra half an hour in their exams to do their work, or they'll get an extra half an hour to complete stuff.
I think that's changed.
No, it's still the case. It's still the case.
Okay.
So when you get the extra half an hour, so therefore the child gets a better, gives the child a chance of getting a better grade. Therefore, the school looks better because of their performance level with the Ofsted and things like that.
But if they see an unruly, impulsive, poorly compliant child, that's going to lower their ratings.
That is true, but you've also got to consider particularly in more sort of state schools, and you've got 30 children to a class. It's very hard to give your attention to one child constantly.
Okay, but you see that they do have extra facilities, but it needs a lot of work to access. So the law, from the age of 5, all children have the right to full-time education. That's the law. So therefore, it is the law that schools take all the steps to ensure that the child attends full-time education. I've seen parents picking up their kids at half day because they've got ADHD and autism or whatever it is, and they're 7 or 8. That's illegal. The parents are poorly informed. Secondly, the schools have a duty, in fact, from earlier on, before 5, if there are problems, to have a special education needs assessment and an education healthcare plan. So send special education needs plan and EHCP, educational healthcare plan. All schools are legally required, if they see and assess someone as having a problem, they will involve education psychologists, occupational therapists, speech therapists.
Many of those are available to hand at private schools more so.
Private schools less so, okay, because the parents have to pay for all of it.
It's true, but the parents will pay for that because we pay for it. What I'm looking to say is, because the thing is, you say teachers are lazy and things like this. One, they could probably spot it.
Not all, but most.
One of them can probably spot it, all right? They could probably potentially spot it. More likely to spot dyslexia in the work. You're also speaking to, let's say, 30 children in the class, at least now. I don't know, there could be potentially more now. You've also got to consider that in a lot of public schools, a lot of state schools in the UK, in London in particular, you're now dealing with a very multicultural class where English is not the first language for even as much as 50-60% of that class. Not always, but in many cases. So a teacher has got that 45-minute window to teach 30 kids, many of them with English not being their first language, plus deal with people who've got dyslexia, plus deal to do with ADHD.
Okay, that's not your child's problem. It's their problem.
Actually, I think it's the parents' problem. The parents should, if the parent can identify that their child is unruly at home. I'm sorry. I think school is a place for education in terms of you want to learn maths, you want to learn English, you want to learn things like this. It's not there to teach you about transgenderism. It's not there to teach you about sexuality, even though
if your child has a deficit.
But it's about teaching. It's about academia. As a parent, the school is not a nursery. As a parent, you've got to take your responsibility. You should take responsibility for your own child's upbringing,
but you see,
teaching them the values and identifying what the risks they are. And if you don't know what
it is, that's for normal kids, Andy. No, that's for normal kids. Parents, unless you know there is a condition of ADHD, unless you suspect it, you're not going to think of it. But the teachers who are professionals do. And I'll give you an example. Okay, even my son's got ADHD, and the headmaster, when he was 4 years old, threatened him with expulsion, okay? Until I got involved, until I went through their website and the law and attended meetings and made things so difficult that the school used some of their back funding to provide one-to-one care in the classroom. All schools can do that. And on top of that, if you put together an education healthcare plan, you get funding from the local authority because it's the law. I'll give you another example how bad schools are. There's a big, famous private school in Scotland, a 15-year-old with ADHD who they knew had ADHD. What do they do to this guy? They put him on a behavioural contract because of his impulsive misbehaviour and not sticking to the rules. Now, what do you think an ADHD 15-year-old will do with a behavioural contract? They'll break it. Yeah. So they set him up to fail. It wasn't the correct therapeutic move, given the fact they knew that he had ADHD. And then they expelled him. Although they didn't even do that. They told the parents to remove him so it wouldn't appear on his record. Now, once I saw that, I went through their website with a fine-tooth comb, went through the parental contract, and then I told the parents, don't waste money legally, report the school to Ofsted. Apart from the fact it's the Independent Scottish Schools Authority. They did. The school lost, and they lost the appeal. Okay? Now in Scotland, there's a disability discrimination for children at school tribunal. They're going there, and they're going to win. The law is that you are disabled if the severity of your symptoms affects your functioning, and it's likely, and it's going to have ramifications for your education and future life, and potentially going to get worse. That's the Disability Act 2010. And can I just say also, it is also no excuse to say the patient is well on medication, because disability is considered as if you were off medication. Okay?
So here's the thing. So is there a because the thing is that we're talking about schools. Now, when you're in the school system, you're expected to conform to the whole school environment, listen to the teachers, sit down, be quiet, so the whole thing when we were kids, children should be seen and not heard type thing, in some ways. So would you say people with ADHD in particular are probably more, because you talked about sometimes the social challenges as a child, if it's not treated and things like this, well, they tend to, if they're not the non-conformists, because they're non-conformists, are they the ones who actually would they be the ones who demonstrate more leadership qualities and are the outliers when they actually get older? And the reason I ask that, because if they don't conform to the school system and they're not following those rules, and they're great at starting things but not finishing them.
I think you just answered it. So leaders are not good starters, poor finishers. Okay, they do finish. So what happens with the ADHD?
Actually, do they? Because they do finish. But the reason I ask is because they're great at starting something and getting off the ground. But the thing is, because they are leaders, they would then give the grunt work to people who would then finish.
So you're right. But I haven't seen that very many times. There was one CEO, and indeed his son asked me to see his father. And he said, I think my dad's got bipolar disorder. He's just all over the place. And so I assessed the father, and actually he had ADHD. So I posed him this question. I said, how on earth have you managed to set up and run a company? Because even the media, because he's quite well known, even a journalist who wrote an article said the interview was typically exhausting, as I would have expected, because the guy's all over the place. I said, how on earth do you do all the stuff you're not interested in? And he said, oh, it's easy, I'll just give it to other people. But most people don't do that. So what will happen with an ADHD person is they'll get things up and running, and then their disorganization and forgetfulness. Because the thing is, if you're a boss, you really got to have your fingers on the pulse and turn up and
you
supervise.
Do, but the thing is, as a leader, do you? And the reason is, because if you look at someone like Richard Branson, he's dyslexic, but he's also potentially got the ADHD according to some sources. he has like 400 companies.
Yeah, but
Now, he
there's also
doesn't manage
grades
that.
of ADHD.
Yeah, of course there is. But what I'm saying is, you're great at starting, bad at finishing, and ultimately, what happens? The thing is, because someone once said to me years ago, to be a good CEO of a company, if you've employed the right team beforehand, your in-tray will always be empty. All you have to do is to make the real tough decisions so that
But
last time.
you've got to get there in the first place, okay? And because they have an inexplicable lack of succeeding, most don't. Um, but interestingly, one of the two criteria for success in life, apart from socialization, is creativity and consistency. And it's very hard to find those two things in the same person, because the most creative people are those with ADHD or those who are bipolar manic. Okay, neither of those are capable of being consistent. But I also tell people, um, ADHD is a superpower because you are highly creative, highly energetic, highly inspiring, and all you got to do is to take the medication in situations where you think it will help you, like a long meeting, or if you have to do lots of studying or paperwork that you can't give to someone else. That's how you then become consistent and able to follow things through. And some people get that and they go, great. So they only take the Ritalin sometimes. Other people's ADHD is so severe, they say, I just want the effect all day, I'll take a slow release. But I won't take it at the weekend, let's say.
So the thing is, if someone wanted to do like an ADHD assessment, even online, is there a checklist that they can find to look at for the traits and characteristics of ADHD?
Just go straight to the Diagnostic and Statistical Manual 5th edition or the ICD-10 International Classification of Diseases 10th edition. Their diagnostic criteria are almost identical. Any other rating scale that you'll come across, the Connor rating scale, is based on those, and therefore anything else is not going to be as accurate as those. But one needs to really understand the ramifications of untreated ADHD. Because first of all, I've begun telling people, if you know your child has ADHD and you do not treat it properly, you're neglecting. And neglecting is the commonest form of abuse, and that's illegal. Okay? I need to be really clear about that for schools and parents. Right? It's very serious because you are potentially fracturing your child's self-esteem and personality.
Is it illegal for a parent?
It's illegal for parents to neglect. And neglect is the commonest form of abuse. Once you are told by a professional your child
I've got to say, it's a
ADHD,
very blurred line in terms of, because the thing is, if you're not experienced, and bear in mind, you've used the measurement as normal people.
no, but once you're told, once you've gone to a professional and said your son or daughter has ADHD and this is the treatment. And the thing is that one should also just mention, you do hear a little bit of, to be fair, I think it's a very poor substitute. But if you take someone to an occupational therapist, they'll say, well, they need stimulation, so use hard putty. Go on play breaks if they're at school and getting a bit bored. All that does is you're trying to physically stimulate them to boost their dopamine. But what a pain in the neck. Just give them a little tablet. It'll sort it out, and they're not treated differently to the rest of their peers.
But if people don't believe in
By the way, there's no addictive potential as long as you're popping your dopamine into the normal range. If you've done a tailored step procedure, there is no side effect. There's no addictive potential and no side effects. Should not affect your heart rate. Should not reduce your appetite. Some people say they eat less, but that's only because on examination they make less impulsive food choices. They think before they choose their food.
Interesting, because I remember, I think it was the 1960s, 1970s, you had a lot of these famous singers and rock stars who took a lot of speed in those days to curb their appetite. It was ultimately, it was, I can't remember the woman's name now, but she took it because so she didn't eat to manage her weight. But that's more psychosomatic than anything else then, really.
Yeah, no, indeed right. But the key thing is that if you see, all you're doing, if you're taking the proper dose, is you're achieving normal dopamine levels. Now, because dopamine is the pleasure neurotransmitter, that also explains why people with ADHD, if they really like something, they can not only do it, but hyper-focus. So you'll often see someone with ADHD reading something that they're interested in, and you speak to them, they don't respond. You shout at them, they don't respond, because they're hyper-focused. Example, Boris Johnson almost certainly has attention deficit hyperactivity disorder, as well as being a psychopath. And he's not interested in being PM. He said so. There are text messages. He wants to leave, but on his terms. But he is interested in ancient Greece. And he's written a book about ancient Greek. Okay? So something that he's interested in, he can do a phenomenal job in. Okay? But something that he's not, he's terrible. Look at Donald Trump. He drinks 7 Diet Colas a day, because a lot of people self-medicate with caffeine and Coca-Cola. And he's fidgety, can't sit through meetings, and he's got the flappy tongue syndrome, a bit like Boris Johnson.
Yeah, but saying that, I mean, Warren Buffett used to drink sort of, cherry colas throughout the day, apparently. But he's got, I don't know what he's got. If anything, or just.
I think he's a bit autistic.
He probably is. Well, saying that, he wanted a public profile, so autistic people. Well, mind you saying that, Elon Musk would be borderline Asperger's as well.
Oh, very, very heavily so. You can just see pictures of him as a child, highly socially awkward. Jeff Bezos, highly socially awkward.
Steve Jobs,
highly socially awkward and dislikable. And all disliked, because they're narcissists as well as being.
So basically, the modern world we live in right now is more suited to the more Asperger side of the spectrum than it is to the ADHD side.
Well, you're right, because it's more technology-based, more digitalized-based, and so you're getting the rise of people who do exactly that. They're binary thinkers. They like the technology. They push the technology. And if you believe in where the Bible says God created man in his own image, these guys are trying to create us in their own image.
The meta world.
Yeah, they're trying to turn us into compliant, subservient robots so they can continue harvesting us.
There you go. And yet, there are outliers out there who don't want to let that happen. Maybe people with ADHD. Anyway,
long may that last. Long may that last.
Anyway, thank you very much for listening, and we'll speak to you on another occasion.
Thank you. Bye-bye.
So I need